She was raped and murdered on duty, which is a very heinous and brutal crime. It's a part two of Nirbhaya. And if we are not able to get safety, security in the work premises, I can't think that where to work and how to work.
So, of course, we are aware that there's this tragic incident, the rape and murder of this resident doctor in Calcutta, and that's very unfortunate. But I want to understand that why are doctors across the nation now protesting? Are conditions similar or worse for them? Do they also work under very difficult circumstances?
See, the incident with the doctors are happening daily. The strike of doctors are on India. It's a pan-India strike. It's because of the brutal rape and murder that has been done with a resident doctor at the RG Medical College, Kolkata. And she was raped and murdered on duty, which is a very heinous and brutal crime.
Yes, in fact, it reminds me of the Nirbhaya incident which happened years ago in Delhi. I think it's very similar to that.
Actually, we all are quoting it's a part 2, the part 2 of Nirbhaya regarding the amendment 2.0. Initially, it was in the media that the concerned resident doctor has committed suicide. And when the post-mortem report came, we all were shocked because I guess this is the first time in India in the history of the medical fraternity in the country that some resident doctor, female resident doctor, has been raped and murdered.
For doctors, it's very important to work, to be able to concentrate on patients. So, do you think that there's this atmosphere of fear which is not allowing you to do that, and which is why you've started this strike, if I may call it so?
The female resident doctors are working under fear because see, 75% of our time are in the hospital, are in the hospital premises, in the work premises. And if we are not able to get safety, security in the work premises, then I can't think that where to work and how to work.
While I understand that, of course, the situation for doctors across India, in fact, we know that according to a study, over 75% doctors have faced some kind of violence in their career. But I want to understand and ask, what are your demands in this case?
The demands related to the case are: number one, the whole case should be transferred to the central agency, that is the Central Bureau of Investigation, CBI, who should give a unbiased, fair inquiry in related to this case. Number one. Number two, as the doctor was murdered and raped and murdered on duty, she should be given a martyr. A martyr day should be announced on her death day. Number third, most important is the Central Healthcare Protection Act. The Central Healthcare Protection Act is the act that will safeguard the doctors, and it should be implemented all over India.
But then there is also the question that while your demands are completely right, the question remains that every time there is a disruption in health services, it's the patient who suffer. While your demands are completely right, but do you think that the patients are also suffering and this cannot go on for the long term?
We have no other option except going for strike. We also know that it will get affected, but the thing is that we have to say the government that yes, something is happening and we should act accordingly.